Unit 32, Instructing Physical Activity. The main components of fitness are muscular endurance, flexibility, body composition, aerobic endurance, and strength. Strength is the maximum muscular force we can apply against resistance. There are 3 types of strength. There is static strength. This is the resistance against a stationary load. Dynamic strength uses muscle contractions to move heavy loads, and explosive strength, use of fast and powerful muscular reactions. Muscular endurance, the ability to repeat an activity for a length of time using specific muscles. The 2 main types of training that increase muscular endurance are resistance training and circuit training. Aerobic endurance. This is the ability to continuously exercise for extended periods without tiring. Certain sports, such as long-distance running and triathlon, need good aerobic endurance in order to succeed well. Flexibility. This is the range of movement around a joint. Flexibility is a personality trait where a person can stretch their body to extent in different circumstances. Body composition. Body composition is used to describe the percentage of fat, bone, water, and muscle in our bodies. Psychological changes. Hypertrophy. This is a term for the growth and increase of the size of muscle cells. It is usually occurred as a result of physical exercise, and it is mostly associated with weightlifting and weight training. Increased muscle tone. Muscle tone is the continuous contraction of the muscles or the muscles' resistance to stretch during resting state. This is also known as hypertonic. Decreased resting heart tone. This is the decrease in the amount of times your heart beats per minute. A person who has a lower resting heart rate than another is generally more physically fit than the other. Increased stroke volume. Stroke volume is the amount of blood pumped by the left ventricle in the heart during one contraction. Stroke volume is increased by prolonged aerobic exercise to lowering the resting heart rate. Fit principles. Frequency. This is how often you exercise. This depends on different factors like the type of workout, how hard you're working, your level of fitness, and fitness goals. Intensity. This is how hard you work. You have to be able to balance the intensity of your physical activity so that you're not working for nothing or not overloading yourself. Time. This is how long you work out for. This depends on your fitness levels and how much duration your heart can take. Working for a short period of time and you will not progress as much as you want to, but work for too long and you may overload and pass out. Type. This is the type of exercise you do, whether it is cardio or strength training. This is monitored to avoid injuries and to achieve goals. PARQ. PARQ stands for Physical Activity Readiness Questionnaire. This should be used by anyone who is planning to start a continuous exercise program. This is to see if participants should check with a doctor to see if they are ready to become more physically active. Below is an example of a PARQ form that people who want to start an exercise program should fill out. Risk assessment. A risk assessment is where you evaluate the risks that may be involved in a projected activity. It is used to tell people about the significant hazards, to prevent the risk of someone being harmed, and then to create control measures you must take in the future to reduce the risk to prevent further injury. Below is a chart for the likelihood and severity of a risk and a risk assessment itself. Minimizing injury. There are 6 simple steps to minimize injury of an activity. Number 1, fill out a medical questionnaire and lifestyle form. Number 2, fill out an informed consent to show that you are taking responsibility and saying yes for yourself. Number 3, check the training environment to see that it is safe and appropriate. Number 4, ensure the trainer you are using is appropriately qualified. Number 5, check the client before every session. Number 6, Conduct a full warm-up and cool-down to prevent any injuries. Contraindication. This is any factor that will prevent a person from exercising to make an exercise unsafe. Common contraindications are blood pressure higher than 160/100, body fat higher than 30% for males and 40% for females, diabetes, resting heart rate higher than 100, lung disorders, medication for blood pressure, blood thinning tablets, angina, and joint conditions. Code of Ethics. The Code of Ethics covers 4 main areas. Rights. There should be a maintained standard of professional conduct as an exercise professional that is appropriate to your dealings with all client groups and responsibly demonstrate respect for individual differences and diversity, good practice in challenging discrimination and unfairness, and discretion in dealing with confidential client disclosure. Relationships. Your relationship with customers should be based on openness, honesty, mutual trust, and respect, and you should responsibly demonstrate that you are aware of the requirement to make the client's needs a priority, and when planning an appropriate training program, promote the client's welfare and best interests. Personal responsibilities. At all times, your conduct as an exercise professional and personal behaviour should be proper, and you should responsibly demonstrate a high standard of professional conduct appropriate to your dealings with all client groups that meets the image and expectations we aim to maintain for the role of an exercise professional working in the fitness industry. Professional standards. You should commit to ongoing training while achieving appropriate qualifications as an exercise professional to responsibly demonstrate that you are engaged in actively seeking to update your knowledge and improve your unprofessional skills to ensure your service is always of a high standard. Warm-ups. A warm-up is performed to make sure the heart, lungs, muscles and joints are prepared for the following physical activity. A general warm-up is to make sure the body is ready for the activity and knows that it will be active. A specific warm-up is where the movements used in the warm-up are specific to the activity which is being performed. Some of the main components are pulse raisers, joint mobility, dynamic stretching. The physiological changes are temperature raising, widening of the blood vessels, and increased heart/pulse rate. Cool downs. A cool down is to help return the body to its pre-exercise state. The main components of a cool down are returning the heart rate to normal, getting rid of any waste products such as lactic acid, and returning muscles back to their pre-exercise length.